Hi there, how are you doing today?
Doing okay, thank you.
I'm glad to hear that. Could you just introduce yourself? Give us your name, your title, a short bio about you, your credentials, and then state the title of your article for us, please.
Sure. My name's Ethan Lester. I'm a clinical psychologist at Massachusetts General Hospital, Harvard Medical School, out here in Boston. My work consists of a variety of different roles. I work in neurological illness and intervention development. I also work in stroke care and ocular trauma at Mass Eye and Ear and Spalding Rehab. And yeah, most recently had a growing interest and expertise in staff wellness initiatives across the hospital system.
Awesome. I'm glad to hear that. Can you briefly give us an overview of why nurses should read your article?
Yeah, thanks for asking. My article is titled Psychologically Informed Nurse Support. And why I think nurses might find this article important is because during the pandemic and even before the pandemic, there were all sorts of issues in terms of nurses getting the kind of care that they need to be able to do their job. We know that the skills that nurses have coming out of school are so vital to patient care, but the skills in terms of being able to continually do this job well and to feel like they're doing it with a certain compassion and spirit can sometimes be taxed by the healthcare system. So this article has a few different initiatives in terms of developing psychologically informed nurse support programming at your institution.
Fantastic. So, what made you specifically want to write an article on this topic?
Well, this in particular, the work came to me versus me trying to find the work. The pandemic really brought about a lot of fractures in the healthcare system, and we were doing this clinical trial in the neurosciences intensive care unit at my hospital, and we found that the patients and the families were getting better from our intervention, but the staff were still struggling quite a bit with the stress involved with taking care of these patients. So we developed this program, and nurses were able to participate on their own. But as we continued to develop this program, we found more opportunities to formalize this program and put something out there that we thought could be useful for nurses at other institutions. And so the pandemic happened, and really the work seemed to find me more than me find the work.
Well, with such an important topic and something that has been so, in the news and constantly affecting the lives of people around the world for the past couple of years, what are two to three things that you would like nurses to take away from this article?
Yeah. I love the way the American Nurse formats this article, particularly because it presents the takeaways right at the beginning. First, I think nurses, really know that these stressors exist and have only seen them increase during the pandemic. Things like, staff retention and attrition, increased occupational demands, workload, and with this intensifying, we need to find new ways for nurses to be able to participate in interventions that are supported by the institution and that are specifically tailored to decrease burnout and increase resiliency as nurses do this work. And then instead of being reactive to problems, to take a more proactive approach to try and address these features of burnout and psychological distress while doing the important work of nursing.
Amazing. Well, thank you so much for sitting down and doing this with me today. I really appreciate it.
You bet. Yeah, thank you for
And
having me.
of course, I hope you have a wonderful rest of your day.
Fabulous. Thank you.